Chapter 224 is a tremendous step forward, and one needs to focus on not only its efforts on slowing the growth in spending, but on investments in public health, investments in prevention. The idea that we are spending such a large percentage of our income for this one service over time has really negative implications for a lot of other activities that affect our health.
We believe that the single biggest opportunity to bend the cost curve is better coordinating the care of very sick people. We've been doing that at Mass General for more than 6 years now. Not only is it care better, but it's substantially less expensive.
We're already starting to make some progress. We're seeing a lowering of inappropriate use of the emergency department as an example.
Because of internal choices that we've made, for 2012, we actually did more work and got paid less than in previous years. And that reduction in total medical expense continues in 2013.
Government, and particularly government at the state level, has a responsibility to be concerned about total spending, about what is being spent in the private sector as well. In order for hospitals to maintain their current margins, given their cost structure, they would have to extract a 60% premium from privately insured, a rate that we have never seen, nor do I think the private sector can support. So regardless of what the government does, the healthcare system has to become more efficient.
What I think we all need to be aware of is that there are what are feeling to us in hospitals anyway as draconian size cuts in our Medicare reimbursement as we go from 2013 to 2014 are themselves going to have a very deep dampening effect on the rate of increase.
We've always provided affordable health care, so controlling costs will certainly continue to be part of the agenda for community health centers.
We are concerned about quality. This is not just a cost game. We're not going to repeat the errors of the 90s where cost was the dominant issue. The day I came into healthcare out of the wilderness as just another economist, I ran into a physician from California who told me that 40% of healthcare was wasted. Here I am 45 years later, and the same 40% number is still being used.
Over the time period that Stuart drew our attention to today, where we've had such big increases in our national expenditures for healthcare, the underlying health status of the population of the United States has gotten worse.
Some patients are able to choose to go to a tertiary medical center for care that can be provided extremely well at the local area, same quality, same outcomes, lower cost.
If we were to apply the quality measures that we use in healthcare to an orchestra, what we would do is count up the number of musicians in the orchestra. We'd measure the time it took an orchestra to play a particular piece. We don't really have any way to measure the quality of the music.
If, and I want to say if we could develop and understand truly what we need to do to prevent illness, and we're not doing that, that is a sin.
Every time I hear doctors in a conversation about healthcare finance, the first thing that they want to say is, well, it's not all us. We can't do it by ourselves. We need a more engaged public and more engaged around things other than just what is this costing and what is its quality.
The question is, will that data, will your organization, will the hospitals really change the practice of medicine with this information? Right now, I would say, to be fair, I think the jury's out. Yes, there are places where it's changed it. Whether we've gotten our money's worth yet, I don't think so. Whether we have the potential, I actually believe in it.
We're prepared to serve all populations, all age groups, and all income levels. And our focus, of course, is on those individuals who are uninsured and underinsured.
I do think that much more of our notion of a hospital, which today, in our mind's eye, tends to be a brick building at a particular address on at the top of a hill in a community. Instead, as time goes on, it's going to be much more a constellation of community-based services, and that's what we will increasingly think of as a hospital.
What I tell others as I go around the country is that I think we are making a difference. And as I pointed out, what you're doing at the delivery system and at the insurance system is critically important. The truth of the matter is, if you don't do it, we won't succeed.